Welcome to 6-Minute Critical Appraisal of Research Paper. Today we will appraise balance trial. The title of the study is, Antibiotic Treatment for 7 versus 14 Days in Patients with Bloodstream Infections. The study protocol was published in the year 2020 in BMJ Open.
The trial was published recently in New England Journal of Medicine. It was an investigator-initiated study and various researchers from Canada, Australia, and New Zealand participated in the study. The study was funded by government agencies from Canada, Australia, and New Zealand. The study was conducted as there was lack of evidence regarding duration of antibiotic therapy in bacteremia. Let's see the methodology of the study. It is a multi-centric, open-label, randomized, controlled, non-inferiority trial. It was done in 74 hospitals over 7 countries that increases external validity of the study. If we look at the inclusion and exclusion criteria, they are not very stringent, which is good for external validity. Stratified block randomization was done, which was concealed till 7 days of antibiotic therapy. However, blinding was not reported. Primary outcome was 90-day mortality. Secondary outcomes were hospital and intensive care unit death, relapse of bacteremia, adverse events, secondary infection or colonization by antimicrobial resistant organisms in the hospital, length of stay in the intensive care unit, etc. Sample size was calculated to be 3,626. Considering mortality of 22%, inferiority margin of 4%, power of the study 80%, and alpha error of 2.5%. Statistical analysis included both intentions to treat and per protocol analysis. The primary analysis was determined by whether the 95.7% CI excludes a 4% absolute decrement in survival. Wilcoxon test was used to compare continuous outcomes. The subgroup analysis was based on underlying infectious syndrome causing bacteremia, intensive care versus non-intensive care enrollments, community versus hospital acquisition, gram-positive versus gram-negative infection, and illness severity score.
Let's see the result.
Baseline characteristics are comparable in both the groups in terms of demography, comorbidity, source of bacteremia, and 7 days antibiotic therapy was non-inferior to 14 days antibiotic therapy. Subgroup analysis was consistent with the primary analysis. Strength of balance trial R addressed a clinically relevant topic. It is a very large trial done in 74 hospitals from 7 countries, which increases external validity. The study was conducted with robust methodology in terms of randomization, allocation concealment, subgroup analysis, and followed intention to treat protocol. Finding of the study was also confirmed by subgroup and sensitivity analysis that increases internal validity. Analyze primary outcome with long follow-up, that is 90-day mortality. Included bacteremia with common gram-negative organism like E. coli, Klebsiella, Enterococcus, Pseudomonas, etc., may help to reduce antimicrobial resistance, healthcare cost. Weakness of the study are only 10% of screen patients were included in the study that questions external validity. The study is not blinded that questions internal validity. Bacteremia with Staphylococcus aureus was excluded. Non-adherence to treatment protocol was high. Now importantly, will this trial change my clinical practice? I think yes.